Welcome to the Codecast podcast. Real-world insights for your daily medical coding and billing processes. And now, here's your host, Terry Fletcher.
Hello, everyone, and welcome to the Codecast podcast today. My name is Terry Fletcher. It has been a great October so far, and I'm so happy to record today coming off a big Monday night football win for my Steelers over the Cincinnati Bengals, so I'm in a great mood. We had our backup quarterback. We won 27-3. With the youngsters playing, it seemed like backyard football with Ben out with surgery on his elbow. So I'm pretty excited for the week. I won my fantasy leagues. It was a great week for me. And yes, that's my favorite pastime when I'm not working. Also, a shout out to Dr. Wilson from Ohio, current client, and hopefully now a friend. I'm happy for your Cleveland Browns win. Well, for the moment anyway. You're in my division, but that helped out. So thanks for that. But for today's episode, I'm actually going to get back to coding. And today's Codecast topic is going to focus on specific coding conventions. So I want to discuss how to select the right 7th-digit character for the right episode of care every time. This is a difficult concept in ICD-10 coding, ICD-10 CM coding. I should be clarifying that for the professional side. But hopefully I can make it a little easier for you to understand. I know many of you have reached out and direct messaged me or emailed me to let me know that you're sitting for your coding exams this fall. And this concept is on all exams, even specialty exams. So this is one episode you may have to listen to a couple of times to make sure you get it down. So think of this as kind of your study guide, if you will, and hopefully that will make things easier for you. But first, today's Codecast is also brought to you by Stranger Things, a Netflix original series, netflix.com/Stranger Things, and Black Mirror, a Netflix original series as well, now streaming on netflix.com/Black Mirror. So selecting the right episode of care every time. In ICD-10, it really brought out some new concepts for diagnosis coding. Some are straightforward and others being a bit confusing when trying to interpret the guidelines. And I've mentioned that before. We've had some really kind of interesting guidelines trying to figure out how to interpret them appropriately when we're submitting our claims. One concept, sometimes that's really debated, is how to select the correct 7th character representing what they call episode of care. So the term episode of care, it's really applicable to most injuries, poisonings, and other external causes. And the alphabetic 7th character digit represents the timing of the encounter. So initial, subsequent, or sequela. So when coding injuries typically requires codes from the S and T categories and external causes falling in the V through Y categories. However, depending on the circumstances, you may have other categories that may apply. But some people try to code, say, an episode of care for, say, hypertension, and that would be inappropriate. So the official guidelines, here's what they're talking about. So A, and again, this is in the 7th character space when you're coding for ICD-10 CM. So A, and that's the letter A, the initial encounter, you're going to use A for each encounter where the patient is receiving active treatment. So the term initial encounter used by ICD-10 causes confusion. In the United States, unlike other countries, we use CPT codes to report a face-to-face service. So many of the E&M codes or our visit codes, evaluation and management, those are determined by initial or subsequent encounters or new patient or established patient visit. This same approach cannot be applied with diagnosis coding. A more simplistic way to think about it, initial treatment, is to consider it as active treatment. So the place of service, whether it be urgent care, primary care, emergency department, or even a specialist office, that doesn't impact diagnosis coding. So the key to correct coding is to use the A for active treatment. And that may be applicable to several encounters, from the first visit to possibly even multiple encounters by different providers. So you're not going to be the only one that's going to use the A character. So an example, patient presents to the emergency department with an injury and is instructed to follow up with his primary care physician. At the primary care physician visit, the patient is evaluated and then referred to a specialist for advanced care or treatment. All 3 visits, emergency department, primary care visit, and specialist, would be coded as active treatment for that provider. So active treatment encompasses encounters for the active care of a condition. Once active treatment is completed and the patient converts to subsequent status or follow-up treatment, then you would not use the A initial encounter anymore. And I'll explain how that works. So when we get into the subsequent encounter, which is the character D, so D is in David, the seventh character D describes the patients who receive routine care for conditions during the healing or recovery phase. So that's where that follow-up comes into play. So that patient that was seen in the emergency department and diagnosed with a concussion told to monitor at home and follow up with their primary care in 10 days. No other treatment is needed at this time. So when the patient sees their primary care provider 10 days later, there's really no active or ongoing treatment. So the office visit is coded with D for subsequent. And I've seen practices coded as A because they think it is the initial encounter with that physician, which is what the A is labeled at as ICD-10, but then it goes on to say active treatment. And that's where it can be confusing. So the previous example in the emergency department for the A, let's say that was a fracture. So they may set the fracture, then they may send them to the primary care to figure out what they need to do with that, or to a specialist to say they may need surgery. That's still under active care, trying to figure out what's going on with the patient. But because in the subsequent encounter example, the emergency department physician said there was no further treatment needed, just monitoring, and the follow-up care, so not active treatment, is now going to be followed with their primary care. And it's really, when they say episode of care, it's really what's in the detail of the documentation, as you could probably see. And then sequela, the seventh digit of character used for complications or conditions that arise as a direct result of a condition. So you may see it as scarring from a burn or paralysis from a spinal cord injury. I had one recently that was a gunshot wound from 10 years ago, and now they're still having issues with that because fragments of pieces of the bullets were still in the patient. So that's sequela. And previously, if you remember what was under ICD-9 codes, that was referred to as late effects. So sequela is a residual effect that occurs after the acute phase of an illness or injury that has passed, and now a complication of the original illness or injury brings the patient back for further ongoing care. So an example, a patient had burns to an extremity. The burns are healed, but scarring is preventing the patient from having full mobility. The sequela, or scarring, is sequenced first, with the injury, the burn, because it's responsible for the sequela, sequenced second. And the S is only applicable to the injury or burn, not the sequela code for scarring. So you can kind of see where that's going with that. So it's basically, again, episode of care. Why are they here for this encounter? Now, fractures have their own expanded version of seventh characters, and so you kind of have to say, okay, so now I'm switching gears now and going to fracture, because you need to know in the documentation for fractures, they need to specify location, laterality, which is right or left side of the body, of the injury, and then many payers have front-end edits that will prevent a claim from processing when it's a non-specific or unspecified side of the body when it comes to fractures. So initial versus subsequent encounter for fractures. You're going to have traumatic fractures using the appropriate seventh digit character for the initial encounter. That also holds true for the patient who may have a delayed reaction or delayed seeking treatment for a fracture or non-union. So initial fracture care, you have A, initial for closed fracture, and then B for an open fracture type 1 or 2, initial encounter for open fracture not otherwise specified, or C for initial encounter for open fractures type 3A, 3B, or 3C, and it's actually Roman numeral IIIA, IIIB, and IIC. So this is where the doctor has to get very specific. When I was training for ICD-10, I had to be very careful with the orthopedic physicians and just really take it step by step by step, and staff, because this is one that's really hard to kind of grasp a little bit because there's so much detail needed from the physician before you can even code for it. The subsequent fracture codes are based upon open or closed fracture and then further defined by the healing state of the fracture. So routine, delayed, non-union, or malunion. So subsequent fracture care D would be subsequent encounter for closed fracture with routine healing. And then you have your E and your F and your G, which are subsequent encounter for open fractures. Well, E and F is. And then it tells type 1 or 2 with routine healing. And then you have type 3, A, B, or C with routine healing. Then you get into G and H. And again, these are now open fractures versus closed. And it goes into delayed healing. And then it goes into non-union, and then with or without non-union, and then you get into malunion, and then sequela. So you have D through S when it comes to fracture, and then A through C when it comes to initial. So you have initial and subsequent, and they use all the letters of the alphabet just about. So really take a look at that section, because specificity is the key to telling the complete story of the injury. And then details should include when the injury or accident occurred, or the nature of the injury and the healing status, again, if you're dealing with fracture care. And then certain diagnoses from the musculoskeletal, pregnancy, childbirth, peritoneum chapters can also need a seventh character to indicate the episode of care, but you need to make sure you're checking on those, because not all diagnoses need it. And so you may think you want to add it just to let them know it was the first time the patient had the problem, but it's not there. One of the categories that I talk about often is the T code section for not taking your medication. So patients that are non-compliant, and there are initial encounter versus subsequent. Did the patient on purpose not take it, or how many times have they not been compliant with their medication? And that's a huge issue, basically trying to figure out if a patient is compliant with their medication or not, which could affect the outcome of their treatment. And so that's something that the doctor really wants to take into effect as far as the T code section when it comes to medications. So our coding question today comes from one of my Coding Corner clients in Portland, Oregon. And she had a question about multiple percutaneous coronary interventions. So the physician did a stent, atherectomy, and angioplasty in the left circumflex artery, in the right coronary artery, and in the left main coronary artery. And so different vessels were treated. And so when we do we call it a 3-in-1. An atherectomy means you're taking out atherosclerosis, because the ectomy is the suffix there. Plus they did a stent, which means they're putting in either drug-eluted or a bare metal stent, or some kind of a device that's very tiny into the artery to get blood to flow. And then they balloon it, which means they inflate that area to get a normal diameter of that narrowed section of that artery. Well, when you code for interventions on the coronary side, you code by vessel, not by how many stents you put in, not by how many procedures you do. But the one thing on the code for what I call the 3-in-1, which is the stent, the atherectomy, and the angioplasty, the 92933 code, it has what we call an MUE for Medicare. So this question came up by one of my clients, and she said, Terry, the doctor did the 3-in-1 on the left circ, the right coronary, and the left main, but I'm stuck because the MUE for Medicare only says that it has 2. So what an MUE is, this is they call it a medically unlikely edit for Medicare. So they place maximums on the number of units of service per CPT code that can be reported by a provider for the same patient on the same day of service. So the items billed, basically they have an established number of units. They're saying you most likely would not see this code reported more than twice. So how do you code for that if you're allowed per CPT and Medicare to recognize 3 or any vessel that is treated, so it's a separate vessel? So what I would do, she had coded the 92933 for the LC, that is a modifier. 92933 again, RC59, that's for the right coronary. But what does she do for the left main? Well, she has a couple of options. Basically not code it. That's not kind of an option. But because she's in a separate vessel, I recommended she coded the 92928 with the LM59, because the doctor did place a stent. And so that is part of that code. That's a stent and an angioplasty code. And you could basically, again, going to put your LM59. You're trying to get at least the value for your stent and angioplasty. You're not going to get your atherectomy value, even though you're in a separate vessel, because again of the MUEs. And then there was also a question. She said, and we can't bill for the left circumflex additional stent that was put in because Medicare doesn't pay for branches. Well, let me explain what Medicare says about that. The branches for coronary. So on the left circ, she was in the OM1, obtuse marginal branch of the left circ in the heart. The one thing you have to understand is it's not that Medicare doesn't pay for something if it's bundled. That term bundled means it's included because Medicare says they already paid for it. So the fees or the reimbursement that you get for one of the arteries, you've already been paid, this is according to Medicare, for the value of putting in another stent or treating a branch of the same vessel. And so they're saying we're not paying you anything extra because you've already been paid for it. It would be double dipping. So even though CPT sometimes says you can have it, it doesn't necessarily make it payable. So just keep that in mind. I don't want you to have in your mind that you're telling your physicians or that your physicians have the assumption that, well, they don't recognize, so they're just not paying it. Well, they're saying they did pay you already in the primary service that you provided. They're saying it's bundled, meaning included, that your value is already included for that service. And so just keep that understanding of that reimbursement in mind. Our coding question was brought to you today by SiriusXM Radio, Dr. Radio Channel 110. Check it out live and on demand. Download the SiriusXM app today. So I want to end today, and actually this is a short session today or a short podcast today. I'm hitting the road. I've got a couple of things I need to do out of town, so I wanted to get this recorded so that you always get your Terry Tuesday download. I know everybody has been really sweet about it and said, oh, we look forward to it every week, so I'm excited about that. But this week I just wanted to give you a new way to disconnect that I think we've gotten away from. If you can give yourself 30 minutes, I know some of you can't do that per day, but maybe even just a week, and go for a drive, look outside with no destination. Just put your radio station on that plays music, no talking. And that's funny coming from a podcaster saying no talking. But just think about how blessed you are to have the things you have right now in your life, the people that inspire you and make you enjoy waking up every day. If you have a beach or a place that has a park or trees, just find a bench, get out of your car and look at everything. If you're into taking walks or, just kind of being a little bit active, just, take a little bit of a walk there. If you're tired and you just need to kind of sit there and meditate on something that doesn't have to do with work. Think about things that make you happy. If you only have a cityscape, look at the building architecture or the sky and, what are the clouds telling you? But take the time this week and do it for yourself, not just do it because I'm saying it's a good idea, but do it for yourself, do it for your mental health, and just disconnect for 30 minutes and be grateful for the now. So that's just my thoughts for today, everybody, on this Terry Tuesday. Everybody, make it a good week. That's all for me today. Make it a great day. And thank you for listening to the Codecast podcast.
For more information on medical coding, billing, auditing, and compliance, including how to hire Terry, follow Terry on Twitter @TerryCoder1 or visit her website at www.terryfletcher.net. Podcast producer Joe Kuzma. Music producer Dassassin Music.